Hello. Low testosterone levels in men are common. Around 20% of men will have low testosterone at some time in their life, but few people are diagnosed and treated. This is due to lack of awareness by patients and doctors, especially as symptoms are vague and often diagnosed incorrectly. In the United States, the term low T is used to describe low testosterone levels, but the correct medical term is hypogonadism. We will use the term testosterone deficiency, or TD. TD is classified as either primary or secondary. Primary TD is due to disorders of the testes. This may be due to childhood mumps, testicular tumours, or injury. Secondary TD is due to disorders of the pituitary gland in the brain. This small gland releases hormones that control a number of bodily functions. The pituitary gland can be affected by tumours and drugs, especially opiate-based painkillers, including morphine and cocaine. The most common cause of secondary TD is type 2 diabetes and obesity. TD increases your risk of heart disease and type 2 diabetes. TD is also linked to increased death rates, frailty, bone fractures, sexual problems, depression, and a poorer quality of life. The most common symptoms of TD are loss of erections, especially in the morning, along with loss of libido and a general lack of enjoyment in sex. You may notice that you are more tired than usual, agitated, nervous, and depressed. You may feel physically weaker and not be able to exercise as much. Some men just complain of less enjoyment in their life. Your partner may find it distressing that you have changed so much, especially if they feel you have lost interest in them and your relationship. Because many of these symptoms are vague, they're often put down to stress, hard work, or simply getting older. Doctors often fail to consider TD and wrongly diagnose and treat men for depression. If your doctor suspects that you have low testosterone levels, they will arrange blood tests. You will need to have 2 blood tests taken on 2 occasions. Both must be before 11 o'clock in the morning and before you have eaten or drunk anything apart from water. A diagnosis of TD is based on these blood tests and the presence of symptoms of TD. The guidelines suggest that men with a total testosterone of less than 8 usually need treatment. Those whose level is between 8 and 12 may need treatment if they have severe symptoms. Men with a testosterone level above 12 do not usually need treatment. If you are found to have TD, you will be offered testosterone therapy. Testosterone therapy is usually prescribed as a gel which you apply to your skin each morning. Alternatively, you can have an injection into your buttock every 10 to 12 weeks. This injection is given by the practice nurse at your GP surgery. Treatment is usually long-term but needs to be combined with other lifestyle measures, such as losing weight, especially if you have diabetes. Most patients respond very well to the treatment, feeling more alive and less tired. There is no evidence that testosterone therapy increases the risk of prostate cancer or heart disease. In fact, most studies show that low testosterone is associated with an increased risk of heart disease, and therefore testosterone therapy seems to reverse this risk. If you have any questions about testosterone deficiency and its treatment, please speak to your GP.